Here we go.
Welcome back, everyone. Einstein's Eyes. John and I are ophthalmologists. I'm Carl Rosen, oculoplastic specialist in Anchorage, Alaska. John Ditkoff is an ophthalmologist and a cornea specialist, anterior segment in New Jersey. We trained at Albert Einstein College of Medicine at Montefiore Medical Center.
And that's why we call this Einstein Eyes.
Right. We see we're clever. We're board certified, we're fellowship trained, and we're offering you hopefully some interesting information about your ocular health. Today's topic is blepharitis, very, very common. And since this really falls in John's wheelhouse, John, talk about blepharitis.
So blepharitis, one of the most interesting, stimulating, just kidding. Blepharitis is usually, when I joined my partner many years ago as a corneal specialist, he was very excited to give me all of his blepharitis patients. Because for us as ophthalmologists, unfortunately, this is a little bit boring and a little bit mundane, but to the person suffering from it, it's not. So I see lots of patients. They come in with irritation, burning. They wake up in the morning, their eyelids feel stuck shut. They have loss of eyelashes. They get frequent styes. They'll notice their lids just feel irritated and red and scaly. So these are the kind of symptoms we hear from a lot of people, among other issues we hear. So it is one of those common problems that actually is somewhat underdiagnosed. Patients come in, doctor says, you have dry eye, get out of here. Or, you have an infection, take this antibiotic. 9 times out of 10, it is actually blepharitis, or what we call meibomitis. So meibomitis is technically inflammation of the glands of the eyelids. Blepharitis is inflammation of the eyelids. Why does it happen? Nobody really knows for sure, but technically what we do is we see excess oil build up along the eyelash margins, right where the eyelashes are. When we look with a microscope, you actually see buildup. And that oil collects almost like a dandruff-like material. It could be called scurf. There are some doctors that see mites, which are like little dust mites or like actually bugs that are on the eyelashes, but all of that combined causes inflammation. So when you have chronic inflammation like this, it leads to, like I mentioned, a bunch of things. People wake up in the morning, they feel irritated, their eyelids feel stuck shut, they might get frequent styes, they might just feel like their lids always look red. And when those patients come to me, the good news is you're not going to go blind from this. It's not a real serious condition, but it is definitely an annoyance. So I start out with treatment. The treatment I usually start with is very conservative. I might have patients do what's called lid hygiene. And lid hygiene is very simple. You take a cup of warm water, put a few drops of Johnson's baby shampoo in that mixture, and then you basically have diluted out baby shampoo. And then you take a washcloth and you dip it in there. And it should be warm water. And then each night before you go to bed, or a couple of nights a week, or just when you're in the shower, the key thing is taking that washcloth, dipping it in that mixture, holding it right against your eyelash margins and scrubbing, not patting it, but actually scrubbing right along the eyelashes from inside out, just like that, but with a washcloth. And the key thing is you're removing that excess oil buildup. That's what should happen. When I tell my patients to do that, oftentimes they come back a few weeks later, I look under the microscope and all that buildup is gone if they're doing a good job. And you have to make sure you're doing attention to the upper and the lower lashes, because some of my patients come in, they look much better in the upper lid, but not the lower lid, or vice versa. And if patients do that regularly, oftentimes they can get away with once a week. They decrease the risk of styes. They decrease the risk of all those other issues. In the person that does that and isn't doing well, sometimes what I'll do is I'll tell them to buy over-the-counter eyelid scrubs. You can actually buy them. And that's also effective in scrubbing the lashes. Then there's also a treatment called Avenova, which some doctors recommend. That's a spray that you can spray on the lids. That also helps. The other things that we do in people that are not doing well, despite all of that, sometimes I'll give them steroid creams on an irregular basis, not regularly, because steroids do have side effects and risks, but steroids are indicated in some patients. And then even oral antibiotics. So doxycycline, interestingly, although it's an antibiotic and knocks out infection, it also has a second wonderful property. It decreases the production of oil of the meibomian glands. So if you give somebody who has chronic blepharitis, so with all the treatments I mentioned, if they're still not doing well, I'll usually add doxycycline, which is a pill. It decreases the production of oil of those glands. And guess what? Their blepharitis improves. I oftentimes don't leave them on it. There are side effects to it. I might have them use it 1 week on, 1 week off, or 1 week on, 3 weeks off, just enough to keep it under control with all those other treatments. So that's my blepharitis spiel. I know it's stimulating, really interesting. It's not surgery. It's not vision restoring, but for a lot of my patients, it really is very important.
John, I got to tell you, that was fantastic. I even fell asleep during the talk. But, no, great job. Great job. So another great video. John, you hit it out of the park for Einstein's eyes. Folks, I hope it helped you. I hope you learned something. I did. And we'll see you on the next video. So long.
See you soon.